Hello, it's Dr. Rhonda Johnson, and today is Tuesday, September 29th, 2020. Today is a very sad milestone for this world. Worldwide, more than 1 million people have died from COVID-19. This is more than HIV. This is more than dysentery. This is more than measles, malaria, influenza, and cholera combined. And this is just in 8 short months. Here in the United States, the number of COVID-19 cases are moving back up again. Overall, last Friday, on September 25th, the United States reported more than 55,000 new people diagnosed with new cases of COVID-19. The United States accounts for more than 20% of the world's COVID deaths, with more than 205,000 people who have died from this disease. And we also have the most cases, with more than 7.1 million people infected with this virus. Now, public health officials are sounding the alarm because we have more than 24 states with cases on a rapid rise again. And they're urging people to rapidly and aggressively adopt measures to slow the spread of this virus. Now, lately, we have seen so many public events where people are close together and not wearing masks. But we know who was the uninvited guest at these election rallies. The coronavirus. It was right there amongst the people attending this event, because we know this virus loves large gatherings of people. See, if this virus is suspended in the air for more than 3 hours, it dies. If soap or water or disinfectant hits it, it dies. The coronavirus needs a host to survive, and that host is people, you and I. So we have to get ready again. We have to get ready for the next big, quote, wave of COVID-19. And to get ready, experts from the CDC have recommended that if you're in the high-risk group of people, that you consider the following: stocking up on supplies, maintaining your hygiene practices, and washing your hands often. Avoid close contact with anybody showing signs of sickness. And stay home as much as possible in locations where COVID-19 is spreading, and developing a plan in case of illness. Now, again, these officials from the CDC, they have analyzed the data of these recent spikes in coronavirus cases, and they have looked at where these folks have been. And it turns out that 2 factors appear to play a key role in the spread of COVID-19. That is dining in restaurants and hanging out in bars. And why is that? Because you can't wear a mask while you're eating and drinking. It's very simple. So I want to leave you with a message. I've said this before. We're going to be in this pandemic for another year, possibly. So you have to play the long game for COVID-19. And when you play the long game for COVID-19, you accept that every decision that you make today impacts you tomorrow. It not only impacts you, but it impacts your entire family and connects to a bigger community. We are all in this together. So in essence, you are not just thinking about yourself. You're not thinking about a political party. You're not thinking about your rights. But you have to think about how your actions in this moment impacts others. Not just for today, but for the long game. This virus has totally disrupted life as we know it all around the world. Folks, we have to stay the course. We have to Take the preventive measures to stay alive. Practice the 3 W's. Wash your hands. Wear your mask when out in public. And watch your distance. As always, these views are my own. My only intent is to help save lives. This is Dr. Rhonda Johnson. Stay blessed and have a great day.